Namaste viewers, welcome to Sri Anantha YouTube channel. In today's episode, Swamiji will continue with part 2 of the central nervous system.
Embodiments of law. In our earlier episodes, I spoke about the central nervous system and its function. That was part 1 related to the brain and the other organs of the brain, that is the lobes, which I have explained. And today I am going to speak the central nervous system part 2, which is related to the spine. In earlier episodes we have seen all kinds of ailments which are related to the brain, whether it is ischemic stroke, arteriovenous malformation, arteriovenous necrosis, multiple sclerosis, meningitis, or other organs of the face like nose dysfunction, or eye impairment, or ear impairment, or related to our tongue disorders. All these I have explained. Why I am giving you a topic wise of lessons, series of lessons, is that first of all you should understand the concept of the physiology, biology, biological dysfunctions, disorders, and the pathology. So how our organs are interrelated, how our nervous system is functioning, so that whenever any kind of ailment a patient is undergoing, even a layman when he is undergoing with some ailment, first of all he should understand the concept, what is his problem is. Simply he should not say I am having backache, or I am having some kind of pain in my brain, or headache, or migraine. So all these are ailment names, but there is a cause for everything. Without knowing the exact cause of your ailment, simply if you visit a doctor and take the treatment and whatever they give you, the prescriptions about the medications, and if you have that, definitely that may lead into disorders. So many such cases we have witnessed in our hospital. So for that reason only I am making you understand it is not only in one language, whereas I am giving a complete details in 3 languages: English, Hindi, Kannada. So we want to make more channels also in many languages, and additional 2 languages in coming days I am going to start with Telugu as well as in Tamil. So why this information I am providing you? Kindly understand. Don't ignore this. The reason is that most of this subject and concepts, if you may feel it is not related to me, why should I watch this channel? Please never ignore. So when you understand our central nervous system, peripheral nervous systems are well connected, and from top to toe we are connected with our nervous system. If any dysfunction of any organ may have impact over the other organ. For that reason only I am taking this as a chapter wise. Now in this episode I am coming up with central nervous system part 2 called the spinal cord. So all we have seen the image, physiological image of a person, where in our neck region or in our brain region there is a canal which is connected with our medulla oblongata, and that canal comes down up to the sacrum region. That has been named as spinal cord. So the spinal cord serves as a pathway for sensory information traveling from the body to the brain. and for motor signals from the brain to the body. It releases sensory input such as touch, pain, temperature, and proprioception to the brain, allowing us to perceive and respond to stimuli. Similarly, it transmits motor commands from the brain to the muscles, enabling voluntary movements and reflexes. In addition to its role in signal transmission, the spinal cord also plays a crucial role in coordinating certain reflexes. Reflex actions like withdrawal reflex or the knee jerk reflex, what we call mainly, and rapid and involuntary responses that occur without conscious thought. You might have found most of the time some kind of jerks may take place in your body. That is without conscious thought. So that kind of reflexes are taken place with the spinal cord and the brain. These reflexes are mediated by neural circuits, what we call, within the spinal cord, which can initiate appropriate responses even before the signal reaches the brain. The spinal cord itself is protected by the vertebral column or the backbone. It is surrounded by 3 layers of protective membranes called meninges, which also provide cushioning. Furthermore, if we elaborate this, cerebrospinal fluid (CSF) circulates around the spinal cord, providing additional protection and nutrients to your spinal canal. Now let us talk about the ailment pertaining to spinal cord, what it could be. First of all, the traumatic case, that is spinal cord injury, that is SCI, what we called in short form, occurs when the spinal cord is damaged due to trauma, such as car accident, you can say, or fall, or sports injury. These are the reasons for trauma cases. The severity of injury determines the impact on the body function. Spinal cord injury can result in partial or complete loss of sensory and motor function below the level of injury. So what is below the level of injury? See, when any spinal cord injury takes place, the lower limbs may not function in most of the cases. So that's what we have to understand. And sometimes if it is in the middle of the spinal cord, definitely a man unable to walk or sometimes unable to stand, this kind of symptoms we can find. So the next case is non-trauma cases, we can either say, or trauma cases also. Because of the accidents, it can lead into compression. This compression can be either due to the age related or due to traumatic case. So the spinal cord compression, what is this? This condition occurs when there is a pressure on the spinal cord, usually due to herniated disc, tumor, or spinal stenosis. Now, spinal cord compression can lead to pain, weakness, numbness, and impaired function. So, what is this spinal cord compression? Now, let me explain you further. Compression materializes due to diffuse or bulge in any of the cord, spinal cord. It may be dorsal 1, dorsal 2, dorsal 3, wherever on the either of the side, left or right, if any diffuse or bulge is there, that bulge will have impact over your disc and the nerve compression takes place. Or due to the accident also the nerve compression takes place. So these can be the cause for the spinal cord compression. Now Let us further go to spinal cord tumors. Tumors that develop within the near spinal cord can cause compression and damage to the spinal cord tissue. These also symptoms, if you see, it will be very similar, lead to pain, sensory changes, muscle weakness and difficulty in walking. So tumor can also one of the cause. So tumor, why it comes? Whenever in your nervous system, when sufficient nutrients are not available, or any blood clot in any part of the nervous system of your spine region is there, then that may lead into tumor. The next is spinal cord infection. Infections such as meningitis or abscesses can affect the spinal cord and its surrounding structures also. So these infection can lead to inflammation, tissue damage and neurological symptoms, that is disorder, what we say. So next is spinal cord degenerative disorders. Degeneration is not only related to the age, even for the youngsters, even in the childhood, certain children are having degenerative disorders. It is purely because either in the trauma cases, due to fall or due to accident, or any kind of tumors, due to that also degeneration starts because the circulation of oxygenated blood will be very less. So it is not related to the age only, but it can be for anyone. So conditions like spinal stenosis. Nowadays, if you see, a small child is also having a stress. Any walk-in person in this world, they have stress. So this stress develops the habits of smoking, consumption of alcohol. So these kind of habits changes your nervous system. It damages your liver. It stops blood circulation because of smoking, respiratory disorders. With that, oxygenated blood flow will be less in your pulmonary artery, and which will not supply to your coronary artery. Then the entire nervous system of the body will become carbon dioxide. Due to that, stenosis develops. So when such meningitis or abscesses can affect spinal cord and its surrounding structures, these infection can lead to inflammation and tissue damage. That's what the spinal cord infection speaks about, and especially the neurological symptoms. So this further leads to degenerative disorders, stenosis, I told, spinal stenosis, degenerative disc disease, and spinal osteoarthritis can cause progressive damage to the spinal cord over a time. These disorders can result in pain, limited mobility, and neurological symptoms as spinal cord is affected. So we have to be very careful. This stenosis we should not allow. We should not allow our mind to get stressed, or we should not be in the habit of any alcohol or cigarettes. So be careful. Next is spinal cord vascular disorders. What is vascular disorders? It is something different from other disorders. Conditions like spinal cord infection or arteriovenous malformation, which is very related to your brain. So malformation can take place at any age, whereas this necrosis takes place after certain habits. Whereas malformation, it may be purely due to stress or trauma cases. Due to that malformation, even at the childhood days, it can take place. So that we call it as vascular disorders. So arteriovenous malformation, in short form AVM, can disrupt bodily blood supply to the spinal cord, causing tissue damage and neurological deficits. Next comes spinal cord autoimmune disorder. What is autoimmune? Because now many people comes with a complaint that we have autoimmune disorder. Autoimmune disorders such as multiple sclerosis. Sclerosis means what? Blood clots or aneurysms, whatever it may be. So multiple sclerosis can lead to inflammation and damage to the spinal cord, so resulting in range of neurological symptoms. So in such cases, if you see, most of the people will be affected with the peripheral nervous systems. Their hands may not be working properly, or they are unable to walk, they are unable to withstand at one place, or they may have lack of sleep. So all these disturbances or indigestion or related to backache or any such symptoms, gastrointestinal disorders or cardiovascular dysfunctions, all this comes only because of multiple sclerosis. It is not only in your one spinal canal, it is on the entire nervous system. So that is why we have to be careful. So I will go one by one in my next episode. How about this ailment? Ailment can affect each organ in a multiple way, and why doctors say sometimes there is a multiple organ failure, and how a person die because of this spinal disorder, which is very related to your central nervous system. So with this, you can find out yourself, you can diagnose yourself physiologically, pathologically and biologically how your systems work in you. So thank you, my dear embodiments. So in next episode, I will come up with many other informations related to the central nervous system part 2. Till then, stay blessed. Jai Sai Ram.